Good afternoon, and thank you for joining in today. It was 13 days ago that we announced our first 4 positive COVID-19 cases in the state of Montana. Today, that number's at 90. In so many ways, our state and our nation is a heck of a lot different than it was 13 days ago. As I've said before, there are concepts that we are rapidly introducing during this pandemic that were certainly foreign to us just weeks ago. There's a lot about this particular disease that is presenting really enhanced challenges. The virus may live on surfaces for an unknown period of time and remain in the air for some time after someone coughs or sneezes, creating a range of opportunities for exposure. Exposure may also happen when a person touches a surface or object that has the live virus on it, then touches one's face. There are things that we do know that can make a difference. And pandemics aren't without precedent even here in Montana. Neither are the measures necessary to stop the spread of communicable disease and respond to the emergency. During the Spanish influenza outbreak of 1918, public health authorities closed schools and other public places all across our state. These measures can save lives across the United States even now. We know that for every person who stays at home and avoids large crowds, the better our chances to fight this virus and protect our frontline healthcare workers and our emergency responders. Staying home if you can. No gathering. Staying 6 feet apart from others when you can. Planning ahead to limit your contact with others. These steps will slow the spread of the virus. And ultimately, these steps will save lives. There is no doubt that COVID-19 is causing a lot of hardship for small and larger businesses, workers, and the unemployed, for the grandchildren unable to visit their grandparents in the nursing home and even cautious about visiting them in their own homes, for parents working from home while helping their kids continue to receive a quality education. It's also causing incredible hardships for our frontline doctors, nurses, and other hospital staff across the country. I recognize through all of this that Montanans have always had an independent spirit. Yet at the same time, we've never shied away from looking out for our neighbors. We've always made sacrifices for the overall good of our communities. While the times ahead will not necessarily be easy, Montanans have always pulled together in times of challenge and times of crisis. This is what keeps me, and I know so many others, inspired and optimistic that we'll actually come out stronger from this. But with 90 cases in our state today, in counties reaching from Lincoln in the northwest to Roosevelt in the northeast, and with 38 cases alone in Gallatin County, we have to do more to curtail the spread of this virus. In other states, hospitals are overwhelmed, and healthcare workers are getting sick themselves. I don't want that to become Montana. It's critical that we do everything that we can to cut off the chain of transmission and also make sure as we flatten this curve to buy time for our healthcare workers on the front lines so that they won't have to make what are almost impossible choices in the coming weeks. In consultation with public health experts, healthcare providers, and emergency management professionals, I've determined that to protect public health and human safety, it's essential to the maximum extent possible that individuals stay at home or at their place of residence. So beginning 12:01 a.m. on Saturday, March 28th, we'll be implementing immediate measures to ensure social distancing by Montanans staying at home except for essential activities and services. Such an approach will reduce the overall number of infections in our state, and it will preserve our healthcare resources. Under these measures, Montanans may leave their homes for essential activities, including for health and safety, for necessary supplies and services, for certain types of work, and to take care of others. Additionally, Montanans may leave their homes for outdoor activity, as long as they comply with social distancing requirements. We really are so lucky to live in a state where we have ample opportunities to access our public lands that remain open to recreation. But I'd urge Montanans to use good judgment if a trailhead seems too crowded, and then just find another access point. My administration's been working many hours working with public health experts to ensure this takes the most practical, what we're directing today, the most practical and the most needed steps to slow the spread of this pandemic. So to determine which businesses and workers are exempt from the order and should continue working, we're following guidelines largely developed by the federal government. The Department of Homeland Security put out something on March 19th talking about essential workers and essential businesses. Then the directive, and I apologize for those on the call and here that we didn't get this out in advance, it spells out a bit more within the directive of listing a more comprehensive list of what is viewed as the essential business activities that'll stay open. If an employer has a question about where the industry falls, well, I think this is a pretty comprehensive list. First, do consult the directive and the federal guidelines. Still though, and if an employer has questions, we've set up a 1-800 number that you can call, leave a message, certainly at any time of the day or night. We'll provide as prompt a response as possible. That number is 1-800-755-6672. 1-800-755-6672. But I'd encourage you first to actually look at the directive and look at the federal guidelines as well. I'm taking these measures today because we need to stay in front of this pandemic and slow the growth of infections so that our healthcare system is not overwhelmed. It's our frontline doctors and nurses and taking care of our friends and neighbors. And I'd rather be accused of overreacting than have a healthcare system overwhelmed and unable to help our most at-risk Montanans when they need it the most. I'd rather our doctors and our nurses and our healthcare professionals know that Montanans from all across our state have their backs and are doing our part to lessen their burdens. I'd rather keep as many people healthy as possible. After all, in order to have a healthy economy, we need to have a healthy population. We can't rebuild our economic strength without doing everything that we can to flatten the curve now and to slow the spread. This crisis requires all Montanans collectively to do their individual part to slow the number of COVID-19 infections. The individual actions that we take now will protect more of our friends, family, and neighbors from this dangerous infection. At the same time that Montanans stay at home, know that the state level will continue to do everything, and at the local level, to mitigate both the health and economic hardships. We continue to look into additional protections for consumers. We continue to look for every avenue available to expand testing capacity in our hospital supplies. And we really are, all of us, in this together. And we can get out in front of this together. And when the time comes, again, we will be rebuilding that much stronger of community again together. So I appreciate it. I'll now open it up for questions from the members of the media. If you'd like to ask a question, you can press 5*. You'll be notified that your hand is raised. When we then unmute your phone, you'll be notified that you've been called on to ask your questions. If you raise your hand by pressing 5*, but the question has already been answered, you can lower it by also pressing 5*. Questions? Yes.
I'm wondering, how is this different from what we already have now? And I noticed you didn't use the term shelter in place. Is that what this is?
So shelter in place and stay at home are the same thing. I mean, I like the mayor of the city of Anchorage said hunker down. Like on the one hand, we've been saying the same thing, right? Stay at home. Don't be going to the grocery store 6 times a day. Figure out the ways to actually make sure to have social distancing. But this is a direction to stay at home unless you're outside for either essential work or essential activities, which are defined overall in the directive. It's asking Montanans to use common sense over the next couple of weeks so we can do everything that we can to slow the spread of COVID-19. Phone question, please.
Hi, this is Nikki Willette from Yellowstone Public Radio.
Hi, Nikki.
How's it going? What changed in the past 2 days since you issued where you extended the closure order? Why do this now and not just call for the shelter in place 2 days ago?
Well, a couple different things, Nikki. One of the things that I wanted to do when we extended the closure orders is because I'd heard from both businesses and schools waiting until today or tomorrow to extend a closure order would not be of assistance for them. So from that perspective, wanted to get out in front of that on, I think it was Tuesday, to give people guidance that schools would continue to be closed, the bars and restaurants and some of those businesses would continue to be closed. And this is a rapidly changing and dynamic situation. I mean, that been looking at both what we have from number of cases and trying to go at it in a thoughtful way, and have been working on this actually for the last, I guess, couple of days as well, trying to say what a larger stay-at-home order might look like. Another phone question. Go ahead.
Governor Bullock, it's Tristan Scott at the Flathead Beacon.
Hey, Tristan.
Hey, I'm wondering, this jump today to 90 cases is over 25%. Do you have models showing when coronavirus may peak in Montana, and also whether hospitals could run out of ICU capacity before then?
Well, I think a couple of things, Tristan. I mean, why we're doing things like a stay-at-home order is so that we can actually lessen the possibility of a peaking happening anytime soon. Like, the fewer cases that we have, especially when there's community spread that can occur, the less likely we're going to hit what a level is. But no one really knows what that peak will be and when, and it's the actions that we take together that's going to impact that and lessen that. Now, when it comes to, I think the second part of yours, or when hospitals or ICUs are overrun, again, why we're doing this is to try to ensure that hospitals and intensive care units aren't overrun. Now, we're also, we're doing planning efforts of what happens from a hospital surge perspective for local communities. We're working on, to the extent that we'd have to, figuring out what other facilities we could use if we have COVID-19 individuals or patients that had to be hospitalized, if we had to go beyond a hospital's capacity. And all of that is the sort of, planning and preparing, not panicking, trying to say what might happen. But if we all collectively take the right steps here, that it won't happen. And that's the objective of this order as well as my earlier public health orders.
I have a question about supplies.
Yes, ma'am.
So I know I've already talked with officials in Dolan County and in Lincoln County. People are running out of testing media to actually send swabs to the lab. Is there an ability for the government to help us get more of that?
So a couple different things. And like, I mean, today's Thursday, I guess Tuesday was on a call with every hospital CEO and have had calls of like, how can we make sure that we get the supplies that we need? And so there is coordination to a certain degree at that level. And like one of the viral transport mediums, even it was changed so that it can now be transported in saline properly. So we're working literally every single day when it comes to trying to get both more supplies into Montana and supplies out into the communities. As I said, it's not without some frustration. I think I relayed on Tuesday when we spoke of ordering 2,000 swabs last week, getting that canceled because the supplier said, well, the federal government needs the resources, yet an inability to necessarily get them from the federal government. Was on another call today with the president, vice president, all the nation's governors. And many of us expressed concerns about ensuring that we get the supplies that we need. Now, we know that from a testing kit perspective, that we've been able to, any swab that comes in, we still can get it turned around, and we're still turning around in about 24 hours, but we're constantly talking to CDC as well about pushing to make sure that we have sufficient availability of testing kits.
So is that a concern that we just won't have enough swabs and media? Is that something?
All right. It is a concern for me, for healthcare practitioners, and for governors in every state in the country. Where I think we ended up 7,000 swabs, is that what we got, or 4,000? We got 4,000 swabs. So one of the things that actually we survey hospitals each and every day and ask them to provide us information about what their current supplies are. And in the event, as we see some of these difficult spots, as hospitals haven't been able to get materials through their private lines of, chains, that then we're pushing stuff out to them as well. I mean, we pushed out by about 50,000 N95 masks in the last couple of days. We pushed out 24,000 surgical masks, 60,000 gloves, 14,000 gowns. So we're doing everything that we can, certainly, to get what we can. And governors, I'm not unique in this, continue to push the federal government to do everything they can to actually increase those supplies to our states. Because if I can't get them off the private market, and I'm expecting to get them from FEMA, and we're not getting what we need, then we have real challenges here. Phone question.
This is Chris from Yours News.
Hey, Chris.
You want folks to get outside, but Glacier National Park is plowing this up, going to start plowing next week. It's just going to draw a lot of people to a pretty small area. Can you talk a little bit about the park and
Yeah.
if you've had any conversations with them?
Absolutely, Chris. And as of Tuesday of this week, I sent a letter to Superintendent Mao requesting that the park be closed. We had worked from Sunday until Tuesday, and we got Yellowstone Park closed. And I think that it's one where, we do want people to get outside, but aggregating and congregating in our gateway communities and coming to a park when all of a sudden the park says, well, no fees for everyone, isn't the right message along the way. So I haven't checked in with the park superintendent today, but we'll try to do so in fairly short order. And I think Flathead County as well expressed concerns the park, requesting it be closed as well. What's that? Another one on the phone.
Yeah, Eric Dietrich, Montana State Press. Can you talk a little bit about what, if any, enforcement's going to be here? Is this essentially a voluntary measure, or is there some sort of teeth to it?
Yeah, thanks, Eric. So it is a public health order. So it can be enforced by the county attorney, by the attorney general, by the Department of Public Health and Human Services. So it does have enforcement within it, as do all of these orders. Now, what I hope will happen is it will all be self-enforcing, right? That it shouldn't take a sheriff to say, let's use some common sense here. But it does have enforcement authority in it. Another phone question.
Hi, Mr. Governor, this is Phil Drake. Was just wondering, is there a time length on this order? Have you set a date?
Yeah, thanks, Phil, because I don't think I did answer that in it. So it goes effective at like 12:01 a.m. Saturday, March 28th. And the time frame on it is 2 weeks, so until April 10th. And, you know, I don't want to be extending time frames for a long time. I, like everyone else, would love to get things back to normal. But what we need to do, I think, is be in a constantly assessing mode of, are the actions we're taking making a difference? And when can we take further actions to reopen things? So from that perspective, both the schools and the restaurants and other businesses at the state level, I've tried to keep all of the orders consistent, and they'll, unless, of course, subject to change, but they'll typically be in 2-week periods with extensions if need be. Yes, sir.
Governor, quick question. I don't have the directive in me of directive in front of me of which qualifies an essential worker or not. Do construction workers fall under that directive?
Construction workers are essential workers. Another phone question.
Hi, Governor, Matt Bowles with the AD.
Hey, Matt.
What do you anticipate the effect of this order will be on the economy, given that we just had a really sharp increase in jobless claims in that data released today?
Yeah, Matt, I think, and first of all, I mean, the impact of COVID-19 has already had significant impacts on our economy. I think since March 2016, we've received 21,000 unemployment insurance claims. And that's one of the reasons why I think the federal government has been working on its relief package to actually address some of the challenges that small businesses and large businesses and individuals in our state, address the impacts that this has already had. I think that the question of what happens if we don't curtail this spread and the long-term impacts of the economy are even much more significant than these actions that we're taking today that in some respects aren't that much different than what had been asked in the past, but it provides further guidelines for businesses and individuals. On the phone.
Governor Tom Schultz from Voices of Montana. Thank you for holding these conferences. I wanted to kind of go into that 21,000 unemployment claims. Has that overloaded the system? Are there steps in place? And along with that, maybe a comment on that package that's been passed by the Senate. As that money starts coming in, have you thought about logistically how to distribute that in a timely way?
Yeah, a couple of different things, Tom. That first and foremost, that yes, the unemployment insurance online was kind of overwhelmed, and I think that was last weekend. I think that we made that our number one priority for the Information Technology Services Division. Hopefully everything's working properly as we speak. Now, we still have to see what the final stimulus package is. I am pleased that, that Congress listened to, I think in part, the nation's governors, Democrats and Republicans, in our request for critical support for hospitals, frontline medical professionals, workers, small businesses, local and tribal governments to fight this pandemic, directly to the question of have we figured out how to spend money that we don't have and what the authorities are on that? Not yet. And as greater clarity comes, that's the next thing that we'll face with trying to do. And I guess once we get to restate that, once actually a bill is passed and signed and we know all the guidelines and parameters, I'll be able to provide you greater information on that. Another phone question.
Hey, Governor, this is Molly. Got a couple questions, but two to start with. Wondering what this order looks like for people who are homeless, and then also for people who might be traveling to Montana. Just wondering what shelter in place will look like for those two groups.
Yeah, two different things. I mean, individuals that are experiencing homelessness are exempt from the directive, but certainly strongly urged to obtain shelter, and governmental and other entities are strongly urged to make such shelter available as soon as possible to the maximum extent practicable, consistent with sort of the CDC guidelines. And when it comes to out-of-state travelers, too, that, this directs activities while someone is in Montana. So if you decide to go to Glacier Park, which hopefully will be closed soon, and you're in a hotel, my expectation would be that you'd be sheltered in that facility, that hotel, other than for essential activities and essential services. So we can't necessarily keep, individuals from coming into our state, and certainly hope if someone's coming from out of state, that especially if they're coming from areas of concern, that they're following quarantine policies. But once in state, whether you're Montanan or other, our expectation is that you follow this directive. Another phone question.
Oh, hey, Governor, it's Tristan at the Beacon again. And I'm wondering, as a Democratic governor, if you felt any political backlash from this administration and whether you're at all concerned about that impeding the flow of critical federal resources to Montana.
Tristan, I've had my share of frustrations with the federal government, and at times how that is how things have come out and some things that have been said along the way. But I don't think I'm unique in that respect, and I'm sure that there's probably some local public health officials that have had frustrations with how we've presented things. So I think the time right now is to do everything that we can to make sure that that we get the supplies that we need, and governors, Democrats and Republicans, are all pushing on that. I mean, we had, again, on our call today, listed out priorities that we ask for as governors, allowing maximum flexibility in using the coronavirus relief funds, improving coordination from the federal government when it comes to getting supplies, granting Title 32 authorization to our National Guard for COVID-19 response missions, implementing the Defense Production Act to ensure nationwide medical equipment availability, and ensuring that the federal unemployment insurance systems are prepared for significant increases in applications. So that is an example based off of a call that all the governors of the states and territories had yesterday with some of the things we presented to the White House. To the question of, do I think that Montana would get less supplies or less favorable treatment because I'm a Democrat and the president's Republican? No, I do not. Other phone question.
Governor, this is David McCumber.
Hi, David.
Hi. I'm curious to know if restaurants providing curbside service, takeout service, are going to be considered essential, or will this effectively shut down all of that?
Restaurants providing curbside and takeout are remain as essential businesses. So that doesn't impact them. I mean, there's greater guidance for an essential business, the expectations of what you will do for social distancing, keeping people 6 feet apart. But restaurants and the media are essential businesses, among other things. Please, another phone question.
Yes, Eric Dietrich from Montana Free Press again. I wanted to ask about testing coverage. Do we know at this point whether we have thorough testing coverage in every part of the state, and that people in different parts of the state have been tested? And do you have data on how many people have been tested in particular counties at this point?
So I don't have data on particular counties and how many have been tested in each respective county. The state lab has tested 2,669 people so far. We're testing around 300 to 400 people a day at this point. Today we did 476, or we're doing 476. And that doesn't necessarily account for some healthcare providers are shipping some of their tests to private labs. But in calls with hospital administrators, for example, in every corner of the state, that I haven't heard of individuals being turned back saying that, no, there's zero testing supplies, or we're not just doing testing. Matt Voles, follow up.
Besides the medical testing, what other data is the state using to measure the effects of these restrictions and measures on movement and social distancing? For example, are you using cell phone location data, traffic data, and what do you find?
No, sir, the state is not using cell phone or location tracking data. And look, I mean, part of the reason why that, like, we're not the only state doing this is that there's certain both CDC guidelines that come out, and then we take a look at what's happened in our state and what's the best way to address that. But there hasn't been any use of electronic data aggregated at the state. And we also meet with epidemiologists to try to say, what do we know about where we are? And it's one where, you know, how many times have I said it's rapidly changing dynamic? And boy, I look forward to the day that I get to stand up here and say, well, I think that we're completely contained. But I think we're going to see greater numbers before we see less. We do know that we can mitigate those numbers if we actually follow this order and other directives to stay at home and follow practices of both hygiene and social distancing. Phone question.
Yes, Governor, this is Casey Elliott at the Dillon Tribune. Are we at the point where we're testing everyone or just those that are symptomatic? And do you expect we will get to that point at some point?
We are at the point where we are testing people that are symptomatic and either from travel experience, travel history of a place of concern, or positive contact with somebody that has been COVID positive. So not everyone gets tested. And it's up to the medical practitioner, the doctor, to actually order the test. Do I think that we would get to the point where every Montanan was tested? First, candidly, we don't have the supplies. We wouldn't have the testing kits to do it. I think it would also provide some false assurances to people, because just because you're tested negative, like let's say that you were in contact with somebody that was COVID-19, just because you're tested negative on that day doesn't mean that you can't still get symptoms. So the guidance and directives, like if you're traveling from a country of concern, if you just came from Seattle, I would hope you would self-quarantine, because that's not going to change either way from the testing perspective. That if you're in a risk category, you should self-quarantine. It wouldn't necessarily change what we're asking of people anyway, but I don't see a date where, unless technology substantially changes, where every Montanan would be getting tested. But I'd also, yeah, and I'd also add on to that I mean, look, 90 cases is a lot, but we have incredibly diligent public health officials working each and every day to do contact tracing, meaning that if someone ends up coronavirus positive, that they're interviewing them and saying, who all else did you come into contact with? And we still are in a position in Montana where we can mitigate the spread of that by doing the hard work that our local public health authorities are doing along the way. Last phone question.
Governor Stokes again, could you shed some light on the large number of cases in Gallatin Valley? Was it a group setting, or just shed some light on that in Gallatin?
Yeah, and thanks for the question, Tom. I can't, unfortunately, right now. And I've asked many of those same questions because as the public health folks work through to try to figure out, is this spreading by contact from coronavirus positive individuals, or is it that a good handful of people were, traveling to Bozeman or Gallatin County from other areas? That I don't have definition clarity on that right now. To the extent that we get it at some point, though, I will share it with the media. Again, so I would ask folks to do take a close look at the directive, as well as the appendix that lists many of the essential businesses and workers. And I'd ask you to take this seriously. It's one where we as Montanans can help out our friends and neighbors. We can slow the spread by actually following these steps. We can actually make sure, do everything we can so our first responders and our hospitals aren't overwhelmed. We'll continue to do everything we can to plan at the state level, but this isn't addressing COVID-19 isn't done by one doctor or one local county health official or anyone in Helena. Addressing this properly is the responsibility of every single one of us. And I hope that just how we're more than happy to help out a friend or neighbor in need as Montanans, that we'll all be able to come together and take the steps that we can to try to isolate and reduce any sort of further spreading of coronavirus. So thanks so much, and we'll continue to try to keep you updated.